Brooklyn Independent Television.
How often have you heard someone say, "I'd give my right arm to keep a friend or a family member from serious illness or even death"? If only more of us would say, "I'd give a kidney or a liver or a heart," there'd be many fewer cases of people waiting, often in vain, for the life-sustaining gift of a healthy organ. Why is there so much resistance to organ donation, particularly within the Black community? What is actually involved in the process? Here to answer these and other questions are Dr. Morwell Salifu, Chief of the Renal Division of SUNY Downstate Medical Center, and Dr. Devon John, Chief of Transplant Surgery. Thank you both for being here.
Thank you.
Thank you.
How big is the problem of a waiting list to get an organ?
Wow. Well, the number of patients who have kidney failure every year entering the ESRD program, which is the end-stage renal disease program in the United States, is about 80 to 100,000 patients every year.
80 to 100,000 is hard for people to digest. Can you break it down a little bit about what that actually means? How many people die, for example, every day waiting for an organ, for example?
So let me go further. So we have 100,000 patients who are entering the program for dialysis, particularly every year. And out of that, 24% of those patients will die in a year, for instance. And the number of patients who are actually entering to become potential candidates for a kidney transplant is way, way, way low compared to what we have on the wait list. So every year the number is increasing compared to the ratio of the number of transplants being performed.
I think the question more so is how many people are actually waiting for transplants?
Yes.
And nationally speaking, more than 110,000 people are waiting for transplants, of which about 87,000 or so, around that number, are waiting for kidneys alone.
So kidney is the greatest demand.
Right.
That's correct.
And what about here in Brooklyn? What leads to such great demand for kidney transplant?
The issue is heavy in Brooklyn because I think we have a more diverse population. There are some specific risk factors for kidney disease, and those risk factors tend to be more prevalent in our geographic area. Diabetes is very common, hypertension is very common, some types of kidney disease are more common in African American populations particularly. So we tend to be disproportionately affected. If you take New York State, for instance, the burden of kidney disease is actually more in Brooklyn and the surrounding areas compared to when you go to upstate New York, for instance. And that is also evidenced by the number of patients on dialysis in Brooklyn alone compared to the number of patients on dialysis in the entire New York State.
Right. The other thing is we've already gotten off talking about kidneys, but could you talk a little bit about transplants in a broader transplantation services in the broader sense, just what's done at Downstate in general?
Yeah, Downstate has a very long history of transplantation. It's one of the oldest kidney transplant programs in the world.
And one of the best. Don't forget Dr. Kuntz.
Dr. Samuel,
Exactly.
Dr. Samuel Kuntz, who started transplantation at Downstate, was one of the, shall we say, the fathers of transplantation, and left a legacy to which we both walk in his footsteps. In so doing, Downstate has done more than
3,300 transplants since we started in 1972.
So I would like you to talk a little bit broader about other transplantation, just to say what else is available.
In terms of availability of solid organ transplantation, can be defined in two forms in terms of tissue and solid organ. And solid organs in terms of transplants, which are being performed on a routine basis within the United States and around the world, which includes heart, lung, liver, kidney, pancreas, and small bowel. In terms of other tissues, you deal with skin, bones, blood vessels, heart valves, corneas, there's a great demand for that, are some of the most common ones that are performed, including bone marrow.
And face.
Oh yeah, skin from face transplants
is a new burgeoning field.
2 face transplants have been done so far in the United States, and I think both patients are doing well.
What makes people so resistant to being donors?
You have about 110,000 people waiting for organs around the country, and that's nationally. And nationally, the number of donors we had has pretty much been constant, about between 7,000 to 8,000, or a little bit more than 8,000 each year. while the demand for organs continue to rise at a greater rate than the amount of supply. And these are from deceased donors, people who've died and wish to donate their organs, or their family wish to donate.
That has to be clarified upfront, because the donation from somebody who has died but is willing to donate the organs after death is different from donation when somebody is actually alive and wants to donate to a loved person.
Well, as a result, because of disparity, many people wait many years for an organ transplant. And the complexity or the complications related to that many people die waiting for an organ transplant.
Yes.
And each day about 17 to 20 people die waiting for an organ transplant. And that's a travesty in its own right, because the technology and the capabilities, both medically, surgically, and by immunosuppressive medications, the medications that have been developed over the years, have allowed extraordinary successes with transplants.
Right.
But when people, we don't have time to talk about what the many of the other complications, but one of the reasons that I wanted you to focus on is why people are resistant to saying on their license or someplace, I give my organs for transplantation.
I will answer that a little bit. Yeah, this issue was really studied in detail by a group called the Minority Organ Tissue and Transplant Organ Program, MOTAP. That's the abbreviation for the
MOTAP.
MOTAP. And what they came up with very interesting findings. African Americans in general have that kind of reservation towards organ donation for many reasons. Not because they don't really want to do it, but what they found was that some people are concerned because of the mistrust of the medical community. That was
I'm glad you said the mistrust, because one of the questions that people ask is, if I write that I want to be an organ donor, and I'm in a car accident and I go to the emergency room, are they going to do less for me because they're just waiting for my organs?
It is just a concept, but
let me address it, because as a surgeon, I have to deal with this more frequently in terms of organ allocation and procurement. But the concept is real to many people. However, it's not real in the practice of medicine. And that is the emergency room team, or the team taking care of someone who has some event, whether it's traumatic or medical, that brings them to the emergency room or to a hospital. That team that takes care of them is a complete separate and independent team than a transplant team.
Yes.
Only when an individual approaches or becomes defined as brain dead, or becomes defined as a potential donor, can the organ procurement team or organ transplant team be contacted and approached to assess a potential donor. And there's a separate independent organization here in New York. It's the New York Organ Donor Network that you can reach through 1-800-GIFT-4-New York. And by doing that, a team is then sent out to the emergency room or the hospital to assess an individual as a potential donor.
So let's put that to rest once and for all. You don't get less treatment if you're an organ donor.
No.
What about culturally? What happens?
The issue of culture was also studied in some of the studies I was mentioning about, and what they found was that at least within the African American community, people were very uncomfortable about giving their organs because of the feeling that the organ may go to another race, for instance.
Might go to another race.
Exactly. That was a major issue in some of the findings.
But given that the number of people on the waiting list is disproportionately high with people of African descent.
That's correct. Yeah. Now, 35% of the people waiting for kidneys are black.
Exactly.
Right.
While we represent about 12% of the population.
So chances are it's going to go to somebody
that looks like you. Furthermore, the overall list, about 50% of the list are people of some minority extraction. So it's far better to donate, because more likely someone that looks like you, if you're a minority, will be transplanted.
Exactly.
Now, one more thing before we have some closing words in the few minutes that we have left. The time has flown by. I wanted you to say, if people have a question or want to get in touch with contact people about being a potential donor, who do they call?
For deceased donation, New York State has a program when you go for your driver's license.
So use that driver's license.
Use the driver's license, and the point is it becomes part of a registry which is shared amongst the organ procurement agencies in New York State.
Okay.
So that there's a little heart in your driver's license. I have one on mine, and I'm a donor, a potential donor. Not a donor yet.
Not right now.
Not right now. And once you get part of that register, it helps. The first thing you have to remember, if you want to be a donor, please let your family know. Okay, so they know
Very
your
important.
wishes.
Exactly.
It's very important because ultimately the decisions oftentimes are made by your family, despite what you may have indicated in your driver's license or any organ
And
donor
let me
card.
just say, if there are 4 children, you have to write it down so there won't be 4 different opinions.
Well, that would be preferable.
That's right, to have it written down.
That's correct.
Okay, we are going to have to leave it there, even though we have much more to discuss. I thank you both for being here, and I hope that out of this conversation, we get some organ donors here in Brooklyn to sign their licenses. And at another time, we need to talk about
That would
what
help
it means
save
to
somebody
be a
else's
live donor.
life.
And save someone else's life.
Exactly.
Thank you both.
Thank you.
Follow us on Twitter at BK Independent TV.